Good morning, students. Today we have to discuss about the continuation topic of previous session, that is anti-ulcer drugs. We already discussed that anti-ulcer classification of anti-ulcer drugs. It is under the course outcome of CO1 and it is under the Bloom's level of K1, K6 and K2. That is, while discussing about the mechanism of action, it is just under the Bloom's level of K1. That is just understanding and remembering the classification. And while discussing about the mechanism of action, it is under the Bloom's level of K2. That is why we are remembering the mechanism of action. And while discussing about the pharmacological action of anti-ulcer drugs, which is under the Bloom's level of K6. That is applying and evaluating. Okay. So we move through the session. We are already discussed the classification of drugs, that is reduction of gastric acid secretion, neutralization of gastric acid, and drugs that produces the anti-ulcer protective action, and drugs that produce the anti-H. pylori action. Okay, so today we have to discuss about the H2 receptor antagonist. H2 receptor antagonists are the drugs which blocks the H2 receptor, which is responsible for the secretion of gastric acid. So, cimetidine, ranitidine, pharmacological, these are the drugs that are responsible for the H2 receptor blocking action. We all know that there are two receptors, that is H1 receptor and H2 receptor, that is produce the action only in the presence of histamine. While histamine bind with the H1 receptor, it produces the inflammatory action. While histamine bind with the H2 receptor, it produces the gastric acid secretion and also cardiac stimulation and also bronchospasm. So, while blocking the H2 receptor, histamine not bind to the H2 receptor because it already filled with the H2 receptor antagonist. What are the H2 receptor antagonists? Cimetidine, ranitidine and pharmacological. Okay, and we all know that cimetidine is the prototype drug because it produces the all pharmacological action as the like H2 receptors. So, while discussing about the pharmacological action, it produces the H1 blocking action and also block the gastric acid secretion. Then we have to discuss about what are the pharmacological action produced in the H1 blocking action. That is, gastric acid secretion is inhibited, cardiac stimulation is inhibited, uterine relaxation is inhibited, and also it produces the bronchial relaxation. Okay, and while discussing about the gastric acid secretion, it decreases the gastric acid secretion. And we all know that parietal cell, which is responsible for the secretion of gastric acid secretion and gastrin, and also what intrinsic factors. While blocking the parietal cell secretion, it blocks the gastric acid secretion, gastrin secretion and also the intrinsic factor secretion. Intrinsic factor is mainly responsible for the vitamin B12 absorption. While blocking the parietal secretion, it inhibits the intrinsic factor secretion that interfere with the vitamin B12 absorption. But continuous use of cimetidine, it does not produce vitamin B12 deficiency because it only blocks the parietal cell secretion, mainly H2 gastric acid secretion. So, it does not interfere with the normal absorption of vitamin B12. Okay. Then we have to discuss about the ADR of gastric acid secretion. Sorry, ADR of H2 receptor antagonist. That is headache, dizziness, bowel upset, dry mouth and rashes. Then CNS side effects like restlessness, convulsions, coma, and renal impairment in accordance with the kidney. And while discussing about the uses, it produces a protection in ulcer, that is by inhibiting the H2 receptor mediated gastric acid secretion, and also it is used in GERD, that is gastroesophageal reflux disease, and it is also used in Zollinger-Ellison syndrome, and it is also used in stress-induced ulcers and prophylaxis of aspiration pneumonia. So let us conclude our topic today. What will we discussed? H2 receptor antagonist. What is the conclusion and uses of H2 receptor antagonist? It is used in peptic ulcer, Zollinger-Ellison syndrome, stress-induced ulcer, GERD, that is gastroesophageal reflux disease, prophylaxis of aspiration pneumonia. Okay. So repeatedly in the university question, we are mainly focused on the anti-ulcer drugs. H2 receptor antagonist is discussed in mainly 2 mark questions.